So in this series of videos, we're looking at gummy smile. If you've looked at a previous video, we discussed about the causes of gummy smile. What causes the gummy smile? If you have not listened to the video, please do watch that video again. In this particular video, we'll address that specific patient question where she's having a lot of gum show and she's not able to smile, very conscious of a smile. So very measured smile. She was asking what can be done. So we look into the treatment options of gummy smile in this particular video. Hello all, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai Rajanamalapuram since the year 2001. If you have not yet subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So when it comes to gummy smile, as I said in the previous video, the treatment will basically depend on the reason why the gummy smile is caused. So typically if it's going to be a premaxillary excess, that is our upper jaw, which is excessively forward in front, or if the jaw is placed too far lower, now the best option would be to do a surgical correction of the jaw. So it's typically the surgical correction of the jaw will involve, of course, taking a thorough CT scan of the face and the jaws, and then doing a smile design, combining these both, finding out what is the amount of jaw that is excessive and how can we correct it to improve the smile of the patient. So it's typically a multidisciplinary approach. It's a team approach between the braces specialist, the smile design specialist and the surgeon, working together with the patient to get the best smile that is possible for the patient. So this position of the jaw, sometimes if I identified very early, if this is how the jaw growth is going to be, if we identify the child in a very early age, there can be some functional appliance which the child can wear, typically in a mixed condition stage, that is about, so somewhere between 9 to 11 or 12 years of age, which can favorably move the jaw position or favorably redirect the growth of the jaw, so that we can reduce the amount of surgery that is required or eliminate the need for the surgery required later in life. So this is basically depending upon the jaw position. The next commonest cause is about the excessive tooth is small in size but excessive gum covering. So this is a relatively a simpler process because we can identify the amount of, that is, jaws are perfectly well balanced, placed well, but the tooth is small and the excessive gum growth. So in the tooth is small and excessive gum growth, there can be two methods by which we can correct it. One method is called it's called a crown lengthening or a gingivectomy. That is a procedure which we do where we measure the amount of gum tissue that is there. We do a smile design also. We take a photograph of the patient in full smile, put it in a smile design software, see the amount of gum show that is there. So once we know the amount of gum show that is there, then we actually measure the amount of gum that can be reduced safely, which will not affect the health of the teeth or the gums, see what is the result that we can have, and then actually do what is called a gingivectomy or a crown lengthening procedure. So this procedure, as I said, can be done as two types based on the amount of correction that is required. A little bit of correction, only the gum tissue can be moved up in front, up, which will help to improve the gummy smile, which will correct the gummy smile to a large extent. Or if too much of gum show is there, some amount of gum reduction as well as bone reduction that needs to be done to improve the condition. So based on that particular patient's requirement and the particular patient's smile and the gum, tooth and the bone position, we can do a combination of treatment for that particular patient. So these are some of the methods by which we can do it. For a patient where primarily there is going to be a maxillary excess, that is bone excess, requiring a surgery, the commonest question people ask is, can I do a little bit of crown lengthening, will it help? So this is typically a masking procedure which we do, which will, of course, a little bit of gum correction can be done, even though the jaw position is not going to be altered, because the gum correction that has been done by a crown lengthening procedure, it masks as if the tooth is in normal position, the jaw is in normal position, the patient, we can reduce the amount of gum show for those particular patients. So I hope you like this video. If there are any questions, please do ask in the comment section below. I'll be happy to answer. Please do like and subscribe to our channel. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.